Hi, hello. I'm here with another interesting article about prediction physical violence in schizophrenia, and it's, I think, morally interesting topic as well because, as far as I know, many researchers do not want to predict physical violence, especially in the sample of schizophrenia patients, and it feels like they're accusing of schizophrenia patients with physical violence. It's not like prediction of it in normal population. If it's in normal random population, then it's okay. However, it seems to be there's a literature increased risk of physical violence, and that's why this is interesting. It can be useful study in terms of forensic sciences and can explain something, but also it's not an association study, it's a prediction study. That's why there are also quite interesting articles about machine learning and its use in that type of situations. So anyway, let's read the article. 275 patients were assessed to identify demographic, clinical, and socio-cultural variables as predictors. 7 machine learning classification algorithms were utilized to predict for past instances of physical violence. This study determined that the random forest model performed marginally better than other algorithms. So they they don't mention whether they could predict or not. So let's read the abstract. Patients with schizophrenia have been shown to have an increased risk for physical violence. While certain features have been identified as risk factors, it has been difficult to integrate these variables to identify violent patients. So they identified 103 violent and 173 non-violent through electronic medical documentation. That's also interesting. So because how they select the sample is important. But it seems they select this 275, and it's important how they determine their violent behavior. Is this only behavior, or is like a criminal act, or is this inclination, or how they define is also important. So using these predictors, we utilize 7 machine learning algorithms to predict for past instances of physical violence, predicted with a significant accuracy compared to random discrimination alone, and had different degrees of predictive power. They determined that the random forest model performed marginally better than the other algorithms. So it seems it's better because probably there are many categorical variables, maybe, I don't know. To summarize, machine learning classification and with an accuracy of 62%, and with the area under the receiver operator characteristic curve of 63%. So these are not very high numbers. To summarize, so I think to fairly predict this number has to be at least 70. So it's like a not very good prediction model. To summarize, machine learning classification algorithms are becoming increasingly valuable, though optimization of these models is needed to better complement diagnostic decisions regarding early interventional measures to predict instances of physical violence. And another thing is, so if they are inclined to violence, so what will they do? It's also very important. Like, will they? But it's good to investigate the roots of physical violence, and I hope it can help society as well. Thanks for watching this video. I wish you have a beautiful day. Bye bye.